No one likes going through the whole job application and interview process just to not be offered the job. Let's get prepared. First things first, make sure you dress the part. A nice little button up, some slacks, or putting a blazer on top. You want to look professional, you want to look well put together, and people do notice what you wear on an interview. Even years later, people will talk about this person came in this outfit in an interview. So make sure you look the part and look clean, neat, professional. Next thing, you want to arrive early. Make sure you schedule out your day so that you are not in a rush when it comes time for the interview, so that you can be calm and mentally prepared for the interview process. And there's usually a time period that some interviewers will make you wait for whatever reason after your appointment time. You don't want to keep on getting nervous. Just remain calm, go over your interview questions in your head while you're waiting for them to call you. When you do speak with the interviewer, it could be a sonographer and the manager of the ultrasound department, or a sonographer and the director of practice, or all of radiology. Who knows? So when you meet them, you want to smile, shake their hands, and introduce yourself. Another thing you want to do is bring a copy of your resume. Don't think, oh, they have it on file, oh, they looked at it. No, you need to bring a physical copy just in case. You never know what's going to happen. And people, they will ask you about your education and stuff. And sometimes I'm like, didn't you just read that on my resume? Didn't I put in all this stuff in the application? Why are you asking me to repeat myself? Basically. But that might be part of the test. They want to make sure, they want to verify that you actually went to the schools that you were saying you went to, or you got the education that you did, and make sure you speak confidently throughout the whole interview so that they know that you know what you're talking about and you are being truthful with them. So, speaking of being truthful, when you're asked about your experience, be honest throughout your interview. And I'm going to touch on that a little bit more when I get to the interview questions as well. So, interview questions that you might be asked. Number 1, why did you want to become a sonographer? You want to have a solid answer, and it can't be something superficial like, oh, I just wanted to make some good money in a quick amount of time. That's not what they want to hear. For example, for me, I knew what it felt like to have various symptoms and not know the cause. And going from doctor to doctor, I want to be able to provide answers to patients who have been dealing with various symptoms and they don't have any answers, so they can't get any help with those symptoms. That's along the lines of my reasoning. Next, almost any interview, they're going to ask you, tell me about yourself. This is not the time to start talking about your cat, Susan. This is the time to share aspects of your personality make you a great sonographer, or things that make your character stand out. Do you volunteer in your free time? So that will show that you care about the community that you are serving. Are you good at time management skills? You could highlight that. You could say, I'm very personable. I'm very good with people, talking to people, communicating, things like that. For example, I might say, I'm good at communicating with patients. So I am able to effectively explain the exam to them and explain how they will get their results. For example, if we are running late, I'm good at making sure that I reach out to the patient, I go speak to the patient in the waiting room, update them, and tell them that I'm going to be getting to them as soon as possible. Next, you might be asked, what exams do you have experience in performing? So, if you are fresh out of school and you have experience in clinicals in certain sites, for example, if you have a lot of general abdomen experience, you're really good at renals, or you're good at right upper quadrant exams, you're good at transvaginal exams, you want to highlight those things. You want to say, this is what I have a lot of experience in. However, if you don't have a lot of OB experience, do not say you have a lot of OB experience. Simply say, I had a little bit of experience with OB, but I'm definitely open to learning a lot more. Interviewers do not like you to mislead. You might be thinking, oh, I'm going to make myself sound better. I'm going to make myself sound like a better candidate. But once they hire you and they find out you can't scan, that's a problem. They're not going to be too happy. So You want to be honest and upfront on the things that you are confident in, that you can do independently, but be clear and transparent. Hey, I don't know how to do this too well. I'm going to need some help. So they know what to expect. They know, okay, how long are we possibly going to have to train this candidate? Next, interviewers will often ask, what machines do you have experience performing ultrasounds with? So this is why I gave this tip on my Instagram a while ago. Whenever you are working with certain machines, you need to write down those machines, the exact model of the machine, so that when you do get interviews, you will be prepared for this question, because I forget. I might know the brand, but I might get mixed up on the model. It has taken me a few years to realize, like, Drew, you got to keep up with this information because you will be asked this stuff. So definitely keep a track of what machines you have experience using. Now, one of the questions that I got asked in one of my first interviews when I was fresh out of school and I had not been working for like 6+ months, I was asked something along the lines of, what issue do you think a lot of patients are dealing with when they come to get an exam performed? This was a Department of Radiology head who asked me this question. So I was a little bit even more nervous and I just froze. I don't think I remember giving a response to that question. I was just like, I don't know. And she told me most patients are nervous when they come to see you. So a lot of times we have to allay those fears that they are dealing with and help to calm down their anxiety. I was just like, oh, I was not expecting that question today. But yes, that makes sense. So that is something that they want to be able to see that you are able to do. You're able to deal with different personalities and not just perform the exam. They also want to know that you have the emotional capability to deal with that aspect of the job. Another question they might ask you is, how well do you handle stressful situations? This is important because sometimes ultrasound departments are under a lot of pressure. So you can just run down what your process is, what your mental process is during those situations. So I might say that I try to take deep breaths and look at the facts of the situation. Okay, and prioritize. What needs my immediate attention now that I create? Okay, first I need to do this, then I'm going to do this, then I'm going to do that. Or there's a ton of exams that have been ordered. Which one was ordered first? Which one is an emergent patient? Which one is an inpatient? What can wait and what do I need to do now? So they want to know that you are able to take some mental steps in order to get through the intense times that can come as a sonographer. The other question that stumped me when I was in one of those first interviews with that director of the department, she asked me to tell her about a time when I helped out a department in a significant way. I started stuttering a lot, and whatever I had come up with was just a small help to the department, or that was a small thing that maybe I did for a patient, but not necessarily a department. And she kept on asking me, now I want you to think bigger. What about something else that was greater that you have done? So when you are going through school, you really have to be building up some stories, some examples that you can give during your interview process. And if you have a bad memory like I do, you might need to write those down so that the next time you go to an interview, then you can have that stuff on deck that you can express. Let's say you're super organized and you see that certain things are in disarray in a department. Maybe some paperwork, some worksheets, or you see that the machines are getting dirty. You can say, oh, well, I decided to create some new files for all of the worksheets and reorganize them and label all of those little files, or I cleaned all the machines and helped our department look better for the patients. Something along those lines. The last question that I will be going over, this is not the last tip though. Why should we hire you as opposed to all the other candidates? This is like a tough question to ask. They're like, why should we hire you? What makes you special? Sometimes you can kind of freeze up with that question. Again, you want to lean into your strengths. One thing that I sometimes might say is that patient care is the top priority for me. Making sure that they get an accurate diagnosis, that their imaging accurately reflects what is going on with them. And I like to go out of my way to make sure that I am addressing their actual concerns so that they can feel confident that they were cared for properly at their visit. The interviewers really want to know that you are familiar with your own skill set. You know what you are bringing to the table. You are confident in something about yourself. Or another thing I could say is that I'm very adaptable. I can work in a ton of different situations. I've had experience with working at several different facilities, different types of machines, working for one organization but 3 different locations. So I would have to be familiar with different machines at each facility, and I was able to perform exams of each one fluidly. Couple more tips, couple more important things that you don't want to miss out on that can help you stand out. First, you want to be prepared to scan. A lot of times this will be with your second interview. Some places will make you do like 3 and 4 interviews. Apparently, I did a poll on Instagram and found that out. I guess people are really trying to make sure that they are not messing up when it comes to hiring someone new, putting them on their payroll. Most sonographers are not looking for you to perfectly perform whatever type of exam that they are asking you to perform, especially if you're a new grad. They want to know that they have something solid to work with. You know how to heel toe, you know how to adjust the probe. What they are not looking for is for you to be able to operate the machine perfectly, because they know you are probably not familiar with this machine. So it is important to, if you are looking for a certain button on the machine, they are typically okay with you asking. Usually when I have had to scan for an interview, I'll just say, I'm looking for such and such button, and they'll help me to find that button. Don't be afraid to ask. Just know you don't have to know everything. For example, the interview for the first job that I actually ended up taking, I was asked to do a renal exam. I got the right kidney fine. So was doing the proper imaging. I go to the left kidney. Can't find it. Can't find it for nothing. But the thing was, I looked in the correct location. I looked right over here, and then I looked lower. I looked farther back, or a little bit higher. And at that point, once I could not find it, I think I was kind of quiet. I didn't really say that, hey, I'm struggling, I don't know what to do. The patient was one of the employees, like in an x-ray or something. The sonographer, she started to scan, try to look for the kidney. She was looking in the same place as I was, not finding it. And then she ended up having to have the patient lie flat on her stomach and almost scanning in the middle of her back to be able to get that left kidney. It would have helped, first of all, if I had spoken up a little bit sooner, but she recognized, this is kind of weird. She didn't verbally say to me that, I understand, this was difficult, but I knew she knew that this was crazy. What in the world? Why do you have to get a person to lie on their stomach to be able to find their kidney? And it took her quite a few minutes, the sonographer there that was interviewing me, to get that image. I knew it was not just me. And guess what? I still got offered the job because those were like kind of crazy circumstances. It's not the end of the world if you don't do things perfectly during the scanning process. Just be open and honest. Lastly, you always want to have some questions to ask the department. Some questions you might ask, so why do you have this position open? And this can help you decide, okay, is somebody out because of an injury, a work-related injury? I don't know if this will be a good place for me. If people are just dropping off because of work-related injuries, they might be extremely busy and not be giving their employees enough time to perform each exam. Just a possibility. That does not necessarily mean that. Are they simply saying, oh, this person relocated? Or are they saying, well, there were some issues in the department and we just had to change things up? Suspicious. Quite suspicious. So this interview is not just them interviewing you still have a choice. You still have a choice. You're also interviewing this job too. So you want to have some questions prepared. Another question that you can ask is, on average, how many exams do the sonographers perform each day? This is another way to find out, will you be able to handle the demands of the job? That concludes this video. Definitely give a thumbs up if you came across something that you did not think of at the beginning of this video, and I'll see you in the next one.